Legislatively mandated benefits are benefits you get with your insurance policy, not because you wanted them, not because your insurance provider wanted to provide them, but because your state legislator said that the insurance company had to provide them. If you are one of the 88 people who gets your insurance from an ERISA plan, a large company, your plan is exempt from those state mandates, so you don't have to worry about it. But if you're one of the 82 people who gets insurance policies that are subject to state regulation, you do have to worry about it because you have to pay for those things whether you use them or not. When I talk about mandates, I mean examples like maybe chiropractic care or colon screenings or alcohol abuse treatment. And while I certainly don't object to a state regulating its insurance providers, mandates generally come about because of some intense lobbying by a small group of people, and they add cost. And they add cost for the people least likely, least able to absorb it. I'm talking about folks with typically low-paying jobs that work in small companies and the self-employed. And if you remember from my last episode, I talked about those very same people got the short end of the tax deduction stick. So again, you're seeing these people at a disadvantage. Now, how much cost we're talking about, of course, nobody's really sure. You can, if you look at a study from an insurance company, of course, they're going to start screaming about how it adds 20 to 50% to your health insurance premium. If you look at a study from a state, they say, oh, no, mandates don't cost anything, they're great. I think an independent study recently said that for every dollar spent on a healthcare premium, about 12 cents is for the mandates. And it depends on, of course, what the mandate is. For example, a mandated coverage for alcohol or drug rehab can actually increase the cost of your premium by 9%. And there are some heavy hitters, maternity care, preventive care for child services, home health services, and infertility services comprise about 80% of the cost of all mandated benefits. That was per the Boston Globe. I can't say I'm completely opposed to mandates, except, there are a few that I think are a crock. There's something called the slacker mandate that requires insurance companies to extend coverage to dependents up to 30 years old. But it's just another example of guys in our government making decisions for us that they shouldn't be making. If you can afford Cadillac coverage, great, go for it. But not everyone can. So let people have insurance coverage without all the mandates. Let's have a policy out there where you just don't get coverage unless there's an emergency, catastrophic coverage, or you could do what Tennessee does, which they don't pay for the catastrophic coverage. They pay for your day-to-day stuff, like your doctor's appointments, your x-rays, your medicine, but there's a $25,000 cap. The thing is, let us make that decision.